Nice to meet you.
Nice to meet you.
I'm Dr. Allison Berkey. I'm founder and owner of Beyond Regenerative Medicine, and I'm medical director here at Beyond Med Spa and Wellness Center. We do all kinds of things, beauty and wellness. We have chosen to do a cellular therapy for you because we're going to see if we can start reversing some of the damage in the brain. The brain is very neuroplastic, meaning that it will respond and regenerate if we give it the nutrients that it wants. It doesn't happen with just one treatment or just one thing. It's a combination of things.
Mhm.
And we can go over how deep you want to go into that. A lot of times, depending on severity of injury, you need a couple of treatments with this. Today, we're doing intranasal delivery, which is the easiest of all. It goes directly into your brain because it passes through your nasal passages, which that's why I was checking the ability of airflow.
Mhm.
And I'm going to teach you how to breathe. You're going to be sniffing in as I'm delivering the product. It's aerosolized just like a nasal spray. The goal is it's going to come up through your ethmoid sinuses, which sit in here.
Mhm.
And then you may or may not feel it, but it will pass into the brain through a very thin little bone called the cribriform plate. Now, occasionally, product will drip down the back of your throat. I'm going to hopefully coach you well enough that it's all going to go, you're going to stiff, it's all going to go up. If it's dripping, you can just kind of lean your head forward a little bit or swallow
I'll
it.
be fine.
It doesn't matter. Yeah. Some people, when we do this, it makes you want to sneeze. Obviously, if you sneeze right after this, it's all going to come
Come
out.
out.
So try not to sneeze or hold your nose or whatever you need to do. The way we deliver it is it's still kind of thawing, but we put it just into a syringe and then we use what's called a nasal applicator. So it literally looks like something that you would put in your nose
Mhm.
and it turns the liquid into an aerosolized spray.
Awesome.
So it feels wet. The thing with these tissue products is you have mesenchymal stem cells, you have extracellular matrix, which is a rich blend of healing things that have healing properties. A cellular product does have DNA in it. It is not ever incorporated into your body's DNA. There's been a lot of talk about RNA and DNA lately with everything. This is not something that integrates into your DNA and works its way in. And
Yeah.
okay, so these cells are going to do what they do. They have what's called a chemotactic response. So if your brain is signaling somewhere that it needs help, they will respond to that chemical signal and
Mhm.
go in and help. So you're not an acute injury. There's not inflammation, but there's probably areas that have been disrupted. And
Oh yeah.
so we're going to see if we can get it up into your brain. And all we ask is that you pay attention to things you notice. Some people notice something right away, some people don't. It's very dependent on the person.
Mhm.
So it is really patient specific. If someone has long-standing problems, like both these patients do, the more you're giving the brain to work with, the more results you're going to get. So exosomes we can deliver in the billions. Stem cells stick around longer, so they continue over time. He's getting, a certain amount of mesenchymal stem cells, but they will continue to pop out those little exosomes carrying all the growth factors and things. IV with adult male, you need a lot more because there's a lot of places they're gonna hop off and do their work. Intranasally, this is a good start, and we'll see how he responds. So anyone intranasal, somewhere from 2 to 4 cc's is good. If it was an acute stroke or injury, I might do more. I might do, 2 days apart. Stem cells are a cellular product. They are about 1/10. A cell is 1/10 the size of a thin hair strand, so about 50 to 100 microns or micrometers. These cells, they're not necessarily fragile, but you don't want to mess with anything that came out of freezing that's still viable, which these products you have somewhere between 60 and 80% viability of your mesenchymal cells. Everything else in there is still good, but you want to use a large gauge needle. I've pulled an 18 gauge. With cellular therapy, you have a thickness to it. It's a little bit more gelatinous, and so it's not the clear liquid you're going to see with an exosome. So you want to use the largest gauge needle you have to fill. Yeah. So administration itself doesn't change. A very thin, watery viscosity aerosolizes more easily. Thicker products can adhere to the inside of a needle. They can adhere even into the inside of this. I may, clean that with some saline and spray one more time if I see product stuck in there. This is a MAD nasal applicator. It has a lure lock so that I can use some pressure, which you will need to get the stem cell product or the cellular product through the aerosolizer. So let's draw up our cells. So what I did was I pulled up a little bit of normal saline because I want to flush. I haven't mixed it with the product yet. I'm just going to flush out this little, I kind of go around the walls. Sometimes there's cells stuck to the wall of the vial. So I just kind of go around with that saline and then back up anything. When you have a big gauge needle, you're not going to harm the product. I just want to make sure we get anything that was stuck in there so we have a nice amount of product. Okay, so because you have a mustache, I'm just kind of cleaning the area around where we're going to be treating. Okay, sorry for that. Now, this fits, I'm not going to do it right now. I'm going to show you. I'm going to walk you through it. This fits up the nostril. It goes, I have to get it arranged at a certain angle. You're going to feel me kind of moving it around. When I'm ready, I'm going to close your other nostril. You're going to open your mouth, take a deep breath in. You're going to blow that breath out. And then when I say go, you are going to breathe in with this nostril. It'll feel weird because I have this one closed. But as I spray, you're going to sniff so that the product is pulled up into here. It's going to feel weird because typically we breathe with our mouth closed, but I'm going to have you keep your mouth open. Ready? Okay. So I am going to have you take a deep breath in, blow it out. And you're going to take a deep breath in, 1, 2, 3, in, sniff.
Oh, no.
Oh, you're totally open now.
No, it's up there.
Okay. If it wouldn't, if he literally can't get air, I'll do it all on the left side, yeah. Preferably, maybe next time they come in for another treatment, and then you do the other side. Yeah. Okay. I want you to do it with that kind of force.
Yeah, got it.
Okay. All right. And then remember when we sniff and I'm pushing, you won't be able to sniff here.
Got it.
So you can have mouth open or closed, but you're going to take a deep breath in, let that all out, and then you're going to sniff with a lot of force.
Okay, got
All
it.
right, ready? Okay, we're going to do this. And sniff. Good.
Oh.
Did it get in?
Oh, yeah.
Okay, good.
You can feel it in my ear.
I told Annalise to look in her ear. Okay, good.
Yeah. Almost worked better with the more congested one. Like,
Interesting.
just like for some reason it just stuck, Yeah.
Okay.
All right.
So you should not have any swelling, any pain. You should not have a headache. You should not have a fever. If anything like that happens, you need to let me know. I don't expect it.
Yeah.
But yeah, that's it. That's the treatment.
Well, thank you.
And then notice if your cognitive abilities change at all, your memory recall, your, speed of doing math, little things like that.
Yeah. Yeah.
Okay. Executive functioning takes a little bit longer when you're noticing things in your mind, like Annalise was saying. So mood, uplift, breathing clarity, things like that might happen faster.
Yeah.
opening of the ears, that kind of stuff.